I've been on this pathway since 2001 when I started to see the problems. And that's why the aluminum scientists, I've been collecting years of information on. I was involved with even the early vaccines with Lucia Tomovich and about the settling of the adjuvant. If somebody was to come in here, I can prove without a doubt this works, because you don't find the lymphatics in the medical world. I can only use the word detox cleansing.
What are the things that can be said and not be said, and who are these gatekeepers that determine who says what and why?
Anytime somebody mentions this is a cure, I have something that can cure something, it causes a finite term. You can't use a finite term. In the medical world, they can bridge that when they can say you're cured of cancer. But are they really? Maybe that time you're cured. For us, you can't use terms, that you're assisting, but you can't say a definitive word that is making a medical claim. And it keeps expanding, and it's creating a real problem in that the pharmaceuticals can use these in the medical world. So if I give a product to a doctor, they can say and do whatever they want to. If I have a testimony of somebody who says, well, it cured me or eliminated all my toxins, you can't even use the word toxins. We stick to detox cleansing, just like you're washing something, like a soap. And so we just stay in that area so it doesn't create any interruptions in our, we still do the clinical trials. The Oligoscan is not really recognized. It's recognized internationally.
Recognized, how are you defining that specifically?
They don't recognize it as a medical device. It's like thermography. It's an opinion device. You can't use it to treat. We're just looking for, we see something like blocking the pathways.
In school, Linda, did you come across that? Of like things you can say as far as to patients, what you can't say, or was that more products, and if you were like prescribing something?
Nurses can't tell patients certain things.
Oh, yeah.
That's the doctor's job, because we're following doctor's orders. That's basically what nurses do. For me, it was like, okay, let's figure out why. I can teach you about health. I can point you in the direction of, maybe have you heard about this? You have to be careful about how you direct people, because you could direct them wrong too.
If there's people out there who want to become a nurse, and what kind of wisdom would you share from what you've been aware of over these years?
The first thing they told us in nursing school is that change is inevitable. You just have to go with it. And you see that in nursing. I've seen it from my grandfather's style to what my mother saw and what I saw, and the changes that I saw. And when I graduated in the 80s, they were changing the rules so that nurses with a lower knowledge could practice as a nurse in this country. And of course, I was like, no, we don't want unskilled and knowledgeable people. I was working as a nurse in California at the time. And so in California, they were lowering the standards of nursing so that they could get more nurses in from other countries. I went to a state hearing and I spoke my piece about it because, nurses are leaders. I went and I showed up, and I remember just stating how I thought knowledge was very important in nursing.
Because they just want to have a higher volume, thinking that is somehow going to resolve a infrastructure issue or something.
There's always stuff going on in nursing shortages, patient acuities, how many patients are you assigned? And, there's all kinds of stuff that they've done over the years. It is change. Yeah, so nursing, there's a lot of change. I think you have to have a strong heart.
What would you say to someone who wants to become a nurse after becoming aware of working with Mike and Liz with Herbalix and seeing the plant ingredients and that strategy?
Well, there's two different fields there. There's the naturopathic field or the alternative field, and then there's the medical field, and they haven't really melded well together yet. I would just be cautious of just keep your eyes and ears open, and if your heart's telling you something, then you should follow it. I remember standing up against vaccines. I would not give children vaccines when my last job, because I didn't feel like I was qualified enough. I knew enough. I wasn't going to subject children to something I wasn't sure about.
Or if a child had anaphylactic shock,
Well,
you wouldn't. What would you?
Well, I would know that, but it's just I didn't believe in bombarding little systems with all of these things, and there's a time and place for it, and it's like you have to make your choices.
Well, when you find out that the children were getting adult size of the adjuvant aluminum,
yes,
that's
a whole different story.
They didn't reduce the amount of the aluminum adjuvant for children. And the testing was done on mice. It wasn't even, they had never done it on humans. Liver has never really been investigated for the aluminum adjuvant. And that's where in mice, big majority of aluminum gets in. And in human beings, we see it on the Oligoscan all the time on the vitamin D. And the high aluminum rates are always connected. And this goes back to fertility issues, because Linda stays in touch with nurses that are in the operating room. And it's really a tough job because emergency or operating nurses, there's a big turnover. It's a really tough job in the emergency room. But she was saying that the problem is there's a lot of deformities or defects in babies today.
That was from an ICU nurse. Not an ER nurse.
Not an ER, ICU.
It's just what nurses aren't talking about.
Is
what we need to listen to.
Yeah, and so nurses know they know
they know trends.
They know trends. They're seen in the hospitals. That's a good way if you want to find out who a good surgeon is. Talk to the nurses at the hospital. They'll tell you who's got good bedside care, who's able to get the most out of their patients without them dying on them. So that was always something. Who's a good, Does that help, Nathan, on that?
Yeah. Linda, what do you use now as far as Herbalix products daily?
There's soap for cleansing my skin. There's shampoo. I use the Healing Souls. I'm up to a belly fat freedom now. Those are my two strong ones that I use. And I use Respiratory freedom. Thank you. I use that every day when I go out and about. I use it going to the grocery stores. We're just embarking on the breast issues and using the Thermography and the Oligoscans together to help quantify some of the things we're seeing.
What's important about quantifying that to you?
Because the more cases we can look at, the more we'll be directed in the right direction.
It helps the person.
They can
understand.
See it.
They can see what's going on in their bodies. And once Linda can explain to them, because sometimes they don't want to hear from a male. They want to hear from a female who's been in the medical world, has worked with people before. You got the product, you've got the testing devices, and then and the protocols. And then
the protocols are all individual.
And we retest to show them that they're doing their homework. And this can go through the whole family, because everybody can be suffering in the family from something,
we did learn that toxins can be passed on.
They can be. In fact, that's one thing. We have a couple coming in. They own a fertility clinic. They're coming in from St. Louis, Missouri, and we're going to be teaching them, the Oligoscan. It's like when you have people who want to have a child, is to actually detox both male and female. Because we're finding that going to all these Lyme disease conference, people with, the Borrelio, is that they had more autistic children in their group than any other group.
I didn't know that statistic.
Yeah. When I can get, like one of the parents to be, or one of the individuals to be an excreter of heavy metals based upon the Oligoscan, and we use our products to get to that, then this helps with reducing the chances that it can get through the lymphatic system, because genetically the person's passing on their genes. Right. So they're not excreter, the child's not going to be an excreter for heavy metals. And so this has not been looked at, but we do know in drug trials, 80 to 90% of failure rate with drugs, because they don't know the lymphatics. There's no drug clearance. So it's that you think they would want to have better efficacy with their drugs. But now we're looking at, they want to go to AI, and they're going to bring all that garbage into AI and they're going to end up with the same results because they haven't figured out the lymphatic system. It's lymphatics. It's working with lymphatics and working with topical. And Linda is having a great time with this. And
I feel so blessed to be able to volunteer and to be here.
Do you feel like your natural impulse to want to contribute has been more well met in this context rather than working at the hospitals? Do you feel like you can communicate to some more extent, like how you want to and what really aligns with your core values?
Yeah, I was lucky in my area. I could do my preventive stuff in the medical field where I could. This is really where I want to be. I mean, it's totally different. It's medicine and it's alternative medicine. We're looking at something different. We're trying to find out why, not just to use a drug to cover it up. We want to find out why and how can we help you. And this is how you can help yourself. You need to be aware of, the toxins we're bombarded daily with the satellites falling out of the sky, and people are just starting to realize about the aluminum chloride that's coming into our atmosphere from that. That's documented too. And they don't know the results of that. And they say that on the medical or the scientific websites. It's interesting. Bombardment.
I think because we're working with the lymphatics, we see an inroad, Nathan, to people are taking drugs, multiple drugs, and we're seeing the issue, and we're able to kind of try a different approach that maybe if AI was so smart, don't you think it could figure out how to get people off medications? Well, we figured out that by opening the lymphatic system, it's very interesting how it infects different organs in the body, from the heart, the thyroid, the breast, prostate, gut, liver, lungs. So we're finding that all these organs have their own lymphatic system. And so the lymphatic systems over these organs go to the surface. They go to the acrocynium ducts, but the bypass is through the skin. And so when somebody says, well, I'm going to test your product and put it on one leg, and then a month later they show me that the one leg's thinner than the other, I go, well, you've proved your point and I'm grossed out. Would you please do the other leg now so we can get it evened up? People are always testing it, but it's a new area. And so we appreciate somebody like yourself, Nathan, promoting the idea that there's a part of the body that's not even been looked at or taught in medical school. Why would you punish people like us for discovering something that can be managed? Because we brush our teeth and shave and we get cleaned up. Imagine that now you can get cleaned up with topicals and get tested before you go into the hospital to clear everything up. But it doesn't happen overnight.
No.
These things take 5 years for a lot of...
at least 2 years for me so that I knew how to self-manage.
Yeah, and you were very aggressive. And some people, they're impatient. They just want to take an aspirin or something. And those have consequences for people.
Right, like a quick fix. We're seeing the push of peptides, for example, or something that is just like a get-rich-quick scheme kind of, people want Ozempic and they want to lose weight fast. And then it turns out that this is, containing venoms and giving people eye cancer and thyroid cancer. It's like the shortcut does not work.
I've known about the thyroid cancer for a long time.
So when you take maybe one of these weight-reducing drugs, it actually affects the muscles of the organ. And this can create cardiovascular. And the food chain is getting worse and worse. I think we're at the brink of something that is now starting to take place. I mean, all these things like the blood thinner was from a farmer had grow something one side and one on the other, and the cows were doing terrible on one side but great on the other, and he brought in, and that's when they discovered a blood thinner from a farmer. He didn't get any credit for it, but...
Working with Dr. Mullane and learning what a workup is, can you both talk about why that is important and what it is?
Well, we use a workup. We use a questionnaire to start with. to
Yeah.
get some history from, because history is very important. Like where you grew up, what air you're breathing, what water you're drinking, what toxins you've been exposed to at work, what's your blood type.
So workup is like getting the orientation.
Well, yeah, and it even goes as far as like I know the area code where somebody lives, and if they live near the Chicago airport, I know they're going to be full, or by freeway, they're going to have higher cadmium. So when I or a cement factory, God forbid, but when I get this, I can kind of see where they're sourced, because everything becomes repetitive. So they're living in the same house every day, and they're getting inundated with maybe the same thing. Same with the food, same with water. So we try to find out what the source of this is causing. And because of my background working with pollutants, heavy metals, because everything from, like in tires of your car, the asbestos from the brakes. I mean, all this adds up during your lifetime.
So a workup is getting the context on the lifestyle and the environmental circumstances so that we can be aware of like how to strategize. Would you say that's the purpose of a workup?
Yeah, it's strategize.
So it can help us identify what we see on the Oligoscan,
Right.
basically.
Yeah, because I can look at a Oligoscan and I can tell a processed food eater right away, because their antimony will be way up. Because of the contaminants in the food, it starts to show up in the heavy metals. So the workup has, your medications. And I have my PDR book. I'll go through a medicine to find out what they're allergic to. I mean, when you put these medications together, what are the black boxes on the thing saying? So when you have it multiplied and you take thermography, we're looking for where the person is, what trouble, and then from the workup, if I can get to see them physically, I can, like turn them upside down, look at the bottom of their feet, and say, "Listen, you're not draining," and that's backed up in your lymphatics. And
so when someone comes in, Nurse Linda, are you part of doing the workup, and do you palpate nodes in the body? Did you learn that in school, or did you get it refined more talking with Mike and learning how he was using that strategy?
Working with Mike on that, practitioners always did the palpation. There were things you look for depending on what diseases and stuff you were supposed to be observing, as a nurse. I learned a lot from Mike, his palpations, and especially now noticing that doctors don't touch their patients.
They don't teach that in medical school.
They don't teach it anymore.
Yeah, no. So what when you see the thermography and you see the area, and then Linda knows exactly where to touch, because she knows where the lymph nodes are, because we've done this so many times. And so she can translate this. And
but I was mostly involved in helping you with your questionnaire
right.
for the history.
So how would someone comes in and they're going, we're part of the workup is happening, they're doing the intake. How do you communicate to the person what palpation is and why it's useful?
I've seen him use it just a couple of times with people that have come in to get Oligoscans to show them where the blocks is, because they can see it on the Oligoscan, what's going on, and then he'll touch it and go, "Oh, how about that point?" And they flare up because he knows.
Well, what I'm asking is before that step, permission from them. How do you approach the language and communicating to the person? Do I have permission to palpate? This is what it is.
Always ask, even at a medical conference, I always ask, because these are areas that,
are tender.
Yeah, tender. And also a male to female, I need permission. And I also that I can, I can see it, and then I can, just point to it. And I said, I'll show you what it is. And they said, I really didn't know that. They may be a naturopath. They may, or functional medicine. They didn't know these things because they don't teach that.
So how do you communicate it though? Do you say can I press below the clavicle here? Or do you ask them?
No.
Would you?
I have women do that themselves, and I point out to where it is on my body. So in other words, like the Chinese, they will have a little ivory figurine, and they'll tell the physician where it is, because a physician in the old days, they couldn't touch a female.
Bodies, yeah.
Okay. And so, they take it and put it on their body. Is this where it's hurting? And so you can direct it that way. So, but I want people to know, especially if I'm at a medical conference, you need to know this information because maybe they didn't have me speaking at this event, and I have to do this like 100 times over a weekend to people to show them, and then I lose my voice. This is
That's why it's good to probably do it to the whole audience. Hey, if everyone wants to like press below where the clavicle is,
yeah,
or the armpits, or do you just do clavicle? What are the regions of palpation that are critical to look at?
For my eye, the first thing I do is have them take their shoes and socks off and have them look at the heel. Then I show off my heel, my 75-year-old heel. And they want to touch it. It's baby smooth. Okay. And then they got the cracks and everything. And then I go, now that this is backed up, let's go up because of gravity. The next area is inside the knee. And so the Baker's cyst, it looks like pseudo Baker's cyst, the formation of the knee. And then it's like they've been wearing compression sock. The backup is in the inguinals. And then that's where the thighs are holding on to all this fluid. And the next point is, I'll go tap the hip point. I said, may I? And I tap the hip point, and they usually go, ow. And I say, okay, the fluid buildup has not only gone this far backed up, it's probably gone up to the lower back. And I know this from looking at thermography and full body scans, and then the last one, are the occipitals, are they sore? Is the mastoid behind the ear sore? Right there, yeah. A lot of times that's sore because they're blocked from an antiperspirant. They wear earrings. They got dental, and all these things are calcified. So the mastoid is one that doesn't drain. So when it feels hard, then I know, and it hurts right there. Yeah. If it feels hard and it hurts, they're not draining. If I have to send them to a thermographer, and they can see that right away. And that backs up. Because of that, usually this backs up, and then I can see all this inflammation up here. The other part is like right here, people have headaches. The neck is, can they twist it? Is it sore to twist?
Yeah.
If this gets calcified, then they can't hardly move their neck.
Yeah, so everyone watching right now, if you want to just do range of motion in a slow direction, left to right, notice if it is sore or not, and then you could take a few fingers and go behind the ear right here on the neck, in that area. If that's sore, then what Mike is talking about, and then what would they do, or what Herbalix product would you suggest when that is blocked here?
Well, first of all, we use the Nighttime Detox Deodorant because you want to open up, because it's a salt.
Open up the acrocynium ducts in the neck, or what are we saying? Oh, okay.
So we got to start where the main drain is for that here.
Yeah, think about where it drains, and that's where you start.
Yeah, so when we start at the armpit and get them off their antiperspirants, then we can start working, and we go up to the next extending thing. And that's where they would take maybe like the belly fat freedom or the detox deodorant and run it up here after a week.
Or two, depends how long, what kind of deodorant they use.
They've been using. Yeah. If this has gone away, it's not sore, and they can palpate it. Some women go, ow, and so they're blocked, and they can't wear earrings while they're doing the detox. Then they will come up and slowly bring it to the edge of the neck area, the cream, because the thing is, if you put it over the neck, and the thyroid is full of heavy metals, it could goiter, because you're extracting the heavy metals and they don't have a place to go. People have goiters because of a deficiency.
It's a thyroid problem.
It's a thyroid problem.
So goiter is like the neck is bulged out and inflamed.
Sometimes Linda doesn't have it, but you'll see two creases in the neck, and in between them will be a bulge. And that bulge is the thyroid just coming out. So if you watch the news reporters, and you'll see a lot of that on TV because they do close-up of the news reporters. And I know they're using antiperspirants. I know they're not draining. And this is, it just, over the years, you can start to see it grow. So the reason why you have to take care of that is because thyroid and breast cancer are involved all the time. because they share the same lymphatic pathway to the underarm. So if I'm taking care of one side of the body, I got to eventually take care of the other side because they need their immune system. So God forbid they've had their thyroid, an operation on their thyroid, because it really can influence their immune system. And then they're on Armor or some thyroid medications. And it could be from fluorinated water around the country, like in New York. And it affects people's thyroids and they don't even know it.
Yeah, and if people want to learn more about water quality, you can watch my videos on structured water, and we go deep into that science of what is structured water defined as, and the difference of cluster size in water and why that matters with the cell, and how it's able to bring in nutrients and take out garbage. So that's why I love what you're doing in the structured water, because I think that they work together. Our body makes structured water from the heart. When we urinate, there's a vortex. So it's it's a very important, when we don't have structured water in our body, we die. When our heart shuts down, then there's no more structured water going from the heart to the organs. And I imagine that it's inextricably linked with the lymphatics. So by structuring water, I think that also improves the lymphatics.
That because you're drinking the water and it's going through the intestines. Where we are right now, they've over-chlorinated the water. So if you're taking medications, it's killing the gut bacteria. So people are trying to do peptides without realizing that, structured water makes a difference, because good water makes a difference, good in, good out. And because the lymph nodes are, once they get calcified, they don't digest the food very well. And there goes your liver bile thing. And then people start to swell,
Is there anything you want the people in the world to be aware of?
Oh, thank you for asking. I just really love what Mike's doing, Mike and Liz together, what they've been able to find out, and to just all the knowledge that he's been sharing with everyone, because research has been what he has been doing for years. And I guess because I'm a researcher, that's why we fit so well together, because I like the research too. Yeah, there you go.
Yeah. I'm blessed to have Liz, to have Linda come in here. We're always kind of talking and looking at how we're making things, and the cases come in, and it's nice to be on the part of the end of where somebody's journey, they're getting better.
Yeah.
We're not stopping, and Linda found this new with a relative. This is going to be because I've been on looking at kidneys, how to help the kidneys. I had was working on a patch for the kidneys to absorb, but I think this, we'll see if this one may even work better.
Thank you for watching this video with Nurse Linda and Mike. If you're interested in any of the products that they mentioned for external cleansing, you can go to herbalix.com. That's herbalix.com. And you can go to shop at the top, and you will scroll down and you'll see the different products that are available and the ones that were mentioned specifically in these videos, including the healing soles that Nurse Linda talked about, that she used on her husband's hands, forearms, and legs. It's mostly used on the bottom of the feet, and I love putting this on the bottom of my feet to keep my lymphatics open so that my feet are secreting and I'm not retaining any metal salts in my feet or body. As you go through their page, you can see there is the Nighttime Cleansing Detox Deodorant that was also mentioned in this talk with Nurse Linda and Mike. This is applied underneath the armpit while you sleep, so it helps to cleanse any toxins or metals that are built up in the axilla area or the armpit. Click the product that you're interested in. With some of the products, there are a few different sizes. You can get it in a stick, or you can get it in a glass container like this. Choose the one that you prefer. Click Add to Cart. Click View Cart. Pneumothrive 20. You will enter that in this coupon code area and apply the coupon, which will give you a percentage off of your purchase. And then click Proceed to Checkout. and enter your billing and shipping information, and you will receive your Herbalix products so you can help your body start externally detoxing and cleansing, which is supportive if you are doing internal detox as well. If you're doing just internal detox without the external detox, it might not be coming out of the body. If you found this video to be useful and interesting, or you learned something new, please consider sharing it with a friend or a family member. Like and subscribe, and we'll see you in the next video. Thank you.